Hi, my name is Chris Perez, and I chose my speech topic as immunizations. I feel immunizations are very important. I have all my children immunized, but I know there's a lot of controversy around them, with celebrities coming out like Jenny McCarthy saying they made her child be autistic and that. So I know there's a lot of controversy that surrounds it. The top reasons that you should get vaccinated, and those are from the NFID.org, National Foundation for Infectious Diseases. Vaccine preventable diseases have not gone away. Vaccines will help keep you healthy. Vaccines are important to your overall health as well as diet and exercise. Vaccines are safe and effective. Vaccines won't give you the disease they are designed to prevent. Young and healthy people can get very sick too. Vaccine preventable diseases are expensive. When you get sick, your children, grandchildren, and parents are at risk also. And your family and coworkers need you. So those are very important reasons to immunize. Another reason that we should immunize is diseases are becoming rare due to vaccinations, like diphtheria and polio. If we would not vaccinate, though, they would not be rare. And we will need to keep immunizing our children until the disease is completely eliminated. So that is something else. We need to protect our future, and our children's children, basically, is what we need to protect. There are 3 safety systems in place that the CDC has in place. The CDC monitors these vaccinations, the FDA, and also vaccine manufacturers. The 3 systems are the Vaccine Adverse Effective Reporting System, which is the VAERS, which reports adverse effects online, mail, and fax. The Vaccine Safety Data Link, which is the VSD, which collaborates with the CDC and managed care organizations with advanced electronic health records. And the Clinical Immunization Safety Assessment Network, which is the CISA network, and that collaborates with the CDC and medical centers to conduct research on adverse effects. And I found this information on www.cdc.gov. It had a lot of good information about why we should and the reasons, common myths that people have for not vaccinating their children. A lot of our vaccinations, the varicella, which is the chickenpox vaccine, prior to its licensing in 1995, almost all people in the U.S. had suffered from this by adulthood. It was highly contagious, and it can be anywhere from mild to severe. But it has made a major impact on hospitalization and death by children getting this varicella vaccine. Tetanus, which is also lockjaw, can be severe and fatal. It is in U.S. primary disease of adults. Worldwide, tetanus in newborn infants continues to be a huge problem. Every year, it kills 300,000 newborns and 30,000 birth mothers who were not properly vaccinated, which I also found this on www.cdc.gov. It is infectious, not contagious, and its bacteria is widespread in the environment. So, mumps is another vaccine that we are commonly vaccinated against, and before the vaccine, it was a major cause of deafness in children, with 1 out of 20,000 reported cases. It's a mild viral disease. The side effects are more common in adults than children, and it is a communicable disease, so we can't let our guard down on that one. Another one that we give is polio. It causes acute paralysis and can lead to permanent physical disability and death. And his victims are mostly children for that disease, which you see a lot of older people like wearing braces and stuff like that who had polio when they were young. Measles is another one. Before the vaccine became available, nearly everyone in the U.S. got it, which I thought was kind of interesting. So, another one is pertussis, which is whooping cough, which actually is making a comeback in the U.S., and a lot of ERs are seeing people with pertussis because of not immunizing their children. It's got a prolonged cough, spells, can't eat, drink, or breathe. Before vaccines were available, nearly all children had this disease, which I thought was kind of an interesting fact. The newest vaccine has been available since 1991. And another one is rubella, which is German measles. And it's usually mild in adults and children, but up to 90% of infants born to mothers infected with rubella during the first trimester of pregnancy will develop congenital rubella syndrome, which is called CRS. Results in heart defects, cataracts, mental retardation, and deafness, which I thought was interesting. So I thought all of these are good facts on why we should immunize our children.